my name is Sonali and I'll be doing educational information on vaping among adolescents and the role of nurses for vaping prevention in meeting the diverse health needs. Let's start with what is vaping. So vaping is a marketed to youth by employing vibrant flavors and packaging which contains substance that can harm the lungs and major health problems, and it also contains, as everyone knows, it also contains with the nicotine. What can be the role of the let's talk about the role of the nurses addressing the vaping in adolescents by determining, raising awareness, assessing risk factors, providing education, coordinating with the multidisciplinary team, and all the role responsibilities of the nurses. Let's talk with the raising awareness. Firstly, one of the most significant role of the nurses in creation of the awareness about danger of vaping. The practice of vaping among the teen has increased drastically in Australia, and being obvious about to the terrible consequences of using nicotine added device to generate the awareness among community. To generate the awareness, school and then community nurse plays vital roles. According to the guidelines of the health profession, it is our role to advise all the people who smoke need to quit the smoking and seeing the risks and harmful of effect of these smokes. We can ask the adolescents about like how often they are using the vaping, or like it is really important to the nurses being a face-to-face within the within the schools community sector, and then give the special educations which can be targeted to the youth to quit the vaping, and also using the social media platforms to platforms to promote advertise of the vaping among the to quit the vaping among the adolescents, and also normative educations for informations where it should be addressed. We should address about the information perceptions of the people's social norms regarding the apple of the flavors, and also talk about the peer influences perceptions about the harming of because of the e-cigarette, and also marketing. So let's talk about the conducting risk assessment. So everybody knows, has as shown in the chart, they this 13.3% of the adolescents in Australia are addicted to smoking e-cigarette. Screening and assessment are critical to provide safe and effective care. We should identify the substance with its potential risks and impact of the on the nurse, youth adult. It should be form part of the assessment to reduce the risk and provide intervention to promote good health and well-being of the adolescents. And we should do the screening of the brief intervention, which can help us to know they are addicted to the vaping or not, by asking how many times they have used the tobacco in the recently, and also screening of the probable disease can be done to detect the disease which have been exposed to the vaping. So let's talk about the education to the caregiver, which is really important roles. Which is really important, which plays important roles, providing education to caregivers regarding the approach to detect vaping. Many times parents are not aware of the prevalence of vaping and how they should talk. Caregiver can be supportive through primary care provisions to teenage by making the coping mechanism against the vaping. Vaping are easily hide and it's hard to detect, so we can give educations to the school administrator and the teachers, and also we can give the education to them about the self-confidence and self-efficiency around the managing epidemic teenage using using vape in schools. So after collaborating with the nurses, we got to collaborate with the multidisciplinary teams like making the nursing programs in schools, primary health education such as doctors, psychiatric, and also giving the motivational interviews by the mental health promoters to prevent from vaping, and also like targeting the perceptions and policies of the education system to decrease incident rate. So in so enhancing the nurses role. So to enhance our nurses roles, I wanted to especially target goal 3 of sustainable development, which is ensure healthy life and promote well-being of all at all ages. That especially targeting I'm targeting to the adolescents. In target 3.4 is strengthened and the prevention of the treatment of the substance abuse, including narcotic, drug abuse, and harmful use of alcohol. As a primary health nurse, according to the Ottawa Charter Health Action 4, I wanted to create the supportive environment to the adolescents to achieve this action. We have to approach sociologically between sociologically to the individuals and surroundings. Accessible support should be introduced by nurses to teenagers populations care to quit vaping. Nurses should be available for the community outreach in the healthcare services. You can ask quick lines by providing helpline like quick lines, and also parental care along with the behavioral therapy should be encouraged by the. So as being a primary healthcare nurse, advocacy plays a vital role in promoting guidance on vaping cessation among the adolescents, and also to promote the policies in Australia's. So the changes can happen. For example, the vaping gonna be stopped from October 2024, coming October, which is really good. And also using the social media platforms can be very effective to promote quitting the vaping, and also to uses of the negative imaginary showcasing about the adverse effect can help a lot. By collaborating with the IT, it's gonna help a lot to quit vaping among the adolescents population. And also thank you so much for hearing me. Hopefully you like my presentation. If you have any question, please let me know.